Hello and welcome to this set of interviews. I'm having a great conversation with you, Mary Selecky, former state health officer for the state of Washington. We'll have lots to talk about, but I wanted to first of all say that this is a study of the factors of success for state health officers, sponsored by the de Beaumont Foundation, supported by the Association of State and Territorial Health Officials, and run by the Fairbanks School of Public Health in Indianapolis. Thanks for joining me.
Oh, you're welcome.
So, Mary, you know that our focus is on success of state health officers. I'd love to hear your definition of success from your own experience and maybe a few of the factors that you think made you successful.
You know, approaching that term success is very interesting when you're at the state level because depending on the issue, it might be a very quick issue with a quick turnaround. And what you're hoping is that you're really going to have a longer term impact on the population in your state. As I think about success, it's always wonderful to have hindsight and to look back and say, what was that thing that really made a difference? And I was very fortunate that I got to serve multiple governors for a number of years. And a big issue for us was tobacco prevention, for example. But it took 10 years to see what difference that made. We did get a smoke-free state, and you see that pretty quickly. You do get some numbers that tell you kids are starting to smoke less, but you're looking for what's that health impact. And as we got more adults to quit, we actually saw a reduction in respiratory diseases showing up in hospitals. So success can look like an epidemiology curve. Success can be a good headline that thanks the Department of Health for doing something very well. Success can also be an okay nod from a governor giving you an atta-girl or an atta-boy for following through on something that was very tough.
You know, it doesn't matter how you define it. You also know yourself and know what factors you brought to the job that made you a success. Talk a little bit about what made you successful.
When I became a state health official, I had had 20 years of experience at the local level. Not everybody gets that opportunity. So I felt like at least I knew the players, I knew the issues from the local level, and I was able to take that kind of local voice to the state level. However, the state is a very different arena than working in local public health. I don't care what state you're in. Because when you do that change to the state level, you have to have a perspective that's much broader. You've got to look at the issues from many angles. Now, all of a sudden, you're the regulator instead of the regulated. Coming to the job of state health official gave me a little bit of a start, at least in knowing the issues, but how complex they were, I didn't have a clue. So that was a major learning curve for me in my first year.
Yeah, I think you actually answered the third question while you were answering the second, but let me just drill down. Is there something you wish you had known on your first day that you didn't, that maybe we could have given you?
When I walked into state service, I thought I understood state government. I did not. And I do have to credit the Leadership Institute that we had at the time, and I was in the inaugural class, about talking about much broader policy issues, about looking at how we would look at it from a different set of lenses. So initially I was feeling very good about taking my local public health experience to the state level, but my learning curve about looking at it from a state policy level, a state system level, and a state impact level was a very high learning curve.
I wish we had time to talk about the Dirty Dozen. Maybe a little later we can do that. But I need to focus on the most important challenge. Give me just one most important challenge you faced in your time as state health officer, and then talk about leadership, lessons learned, and leadership you had to exert.
You know, challenges come in many different shapes and forms. One of those challenges is a very large print headline in the very important newspaper of the biggest town, talking about the Department of Health as licensed to harm. I happen to have the responsibility to license all the state health officials, and there were some things that we didn't do well. That's a very humbling pill to swallow. And to make sure that you've prepared the governor for that kind of headline was going to come, and hope that the governor would stick with you to go through the improvements that were needed. So that kind of challenge of managing the media, making sure the staff didn't lose their confidence in what we were doing, and then leading through the improvements that needed to go on. It was a huge, huge challenge. Another one of the kinds of challenges is certainly everything that we faced after September 11th, 2001. We were not prepared as a system, and we will be better prepared every day that we work on it. But the coming together of state health officials across this nation and learning from our colleagues in the eastern states and Washington, D.C., even though Seattle and Washington State were far away, we needed to be ready for things that we couldn't anticipate. Whether it was the H1N1 flu epidemic, we used the skills that we learned in preparedness. Whether it was when Fukushima blew up in Japan, and while it didn't impact the United States, the amount of fear that people had about radiation impacting them, used every skill of risk communication, giving the public the kind of information they needed so that they would feel comfortable in trusting you that their health was okay. Those are challenges that are not easily defined, and you've got to have skill building and leadership building prior to that to get through those challenges.
I wasn't about to step on that line. Great. Even long-standing health officers eventually have to leave. How did you prepare your agency for your departure, and what was the impact of your departure, do you think?
I had some very interesting experience as a state health official who'd been in the office through 3 governors. And probably the toughest learning was how you transitioned from one governor to another governor, not knowing the outcome of an election, not knowing whether the new governor would ask you to stay, whether you would fit in a new administration, or the new administration would be taking some direction that perhaps you didn't agree with. Those are all unknowns. And only you can share that with another state health official because they go through the same kind of path. Nobody else can help prepare you. And the best advice I got was the way you keep your job is to do your job. That's 1. 2, don't count on anybody's word saying, oh, they'll keep you, or oh, you'll be able to stay, until it's that governor who says to you, I want you. And I think that's an important piece. But also preparing the agency for a transition that could come. Being prepared for someone who's new going to come in. Even though it might be you, or you want it to be you, it still is a new administration. And I think that's an important thing for those of us who have been there through a governor's term. Now, there are also times, I think, when folks have to prepare for an issue they didn't expect, the headline they didn't expect, and a governor saying farewell. And that's a sudden departure. And none of us ever want to wish that on anybody. For me personally, I was looking at a time in my life. I was approaching 66. Is this a time for me to commit 4 more years to a governor? And if I couldn't commit 4, why would I? Now, I have no idea what his plan might have been, the new governor, but I needed to prepare the agency for saying farewell and that you'll be in good hands with the next leader. And indeed, I was very lucky that my successor was just prepared like he was for the job.
Help us with some messaging for the short-term precipitous departers and how they can prepare their agency for the unexpected. A lot of them are coming in and won't be here more than 2.5 years, as we now know.
Right. A number of my colleagues were not as fortunate as I to serve, and maybe they didn't want to serve as long. And what we needed to do as state health officials was support one another. Now, by supporting one another, you also could remind them that when they're going through the bad time, do they have a deputy who's ready to step in? Do they have an administrative team that would be able to make sure that the agency kept humming, that their senior leadership in their agency was ready to handle situations when you weren't there? Because none of us can, predict whether we're there tomorrow or not by either life or by our appointment by our governor. Your job could be gone at any time. So our job was really to build a foundation for which the agency could succeed, not just us.
Mary, your experience, of course, is like mine. You were a local health officer and a successful local health officer before you became state health officer. Help our shows, particularly those who weren't local health officers, to understand the unique relationship between the state and localities.
We have 50 states, the territories, and Washington, D.C. as members of this very exclusive club called ASTO. And one of the things that quickly I learned was to listen to my fellow colleagues about how different their state might have been than mine and not anticipate that it was the same. But every state, regardless of whether you are a state that runs the local health departments, whether you're in a state that has local health departments with law jurisdiction that gives them the authority at the local level, you have to have a relationship. And relationships are everything. All else is derivative. So as a new state health official, paying attention to what's going on in the far corners of your state, listening to those folks who are in the communities is as important as listening to the governor, the governor's policy person, the legislature, because without those relationships at the community level, you can't get much done.
One of the most exciting things about being a former state health officer is we don't stop serving. And you see these opportunities now emerging for us going forward. Can you put your finger on what you think is the greatest opportunity for public health in the near future, where we might be able to put our stake?
You know, healthcare in these days is changing so rapidly. And I know as a long-term public health professional, when I hear a hospital system talking about population health, on the one hand, you want to say, excuse me, I've been doing that for a long time. On the other hand, you have to appreciate how are they looking at population health? Is it in a way that enhances the public's health overall, or the population that they serve that isn't the population overall? So I think those of us who are looking at communities and saying, okay, there are healthcare providers, there are hospitals, there are local doc's offices, the community clinics, whatever the case is, do they have the eyes of the whole community? Because public health has to have the eyes of the whole community. As we look forward, it's important for us to have a voice in those tables, to be at those tables, and to serve, and when you're done being a state health official, in your community in some kind of capacity.
You have the eyes and the ears of the public health and state health leadership on tape right now, Mary. What do you want to say to them as sort of a final bon mot?
You know, your opportunity when you're a state health official is something that not very many people share. So reach out to your colleagues, number one. Create whatever friendships it is that you will create, but use them to help you through the tough times. Secondly, relationships are everything. All else is derivative, whether it's with your governor's staff, whether it's with the legislature and the legislative staff, or the congressional staff in Washington, D.C., that we have to have those relationships in order to have the policy discussions that we need to have when we're the state health official. And the other one is to pay attention to your workforce. Give them a good place to work. If they're not in great buildings, help them get into great buildings. If they need infrastructure updates, and whether it's your IT department or whatever the case is, give them good tools to work with, but also provide the kind of leadership that helps them thrive and create a learning opportunity for them all the time and be a lifelong learning organization.
Mary Selecky, born a leader, but never stops learning. And Mary, you never stop teaching me either. Thank you so much for doing this.
Oh, you're welcome, and good luck with this project.